Hello and welcome to Supervision Smorgasbord, a podcast full of tips, tricks, and interviews with experts to help you enjoy being a supervisor. Here's your host, Dr. Tara Sanderson.
Hello, everybody, and welcome back to the Smorgasbord. Have you ever had a supervisee ask you a question and your first thought was, I hope they don't realize I'm just making this up as I go? Most of us are trained to be excellent therapists. We all know how to sit with a client, but very few of us were actually trained to be supervisors. So we put on this expert mask. We feel like we have to have the answer to every clinical dilemma, every insurance quirk, every ethical gray area. We think that if we show doubt, we lose our authority. But here's the secret. Your authority doesn't come from having all the answers. It comes from having the best questions. The transition from senior clinician to supervisor is a major identity shift. It's moving from the doer to the observer. When we wear the expert mask, we actually stop our supervisees from thinking for themselves. We become a clinical search engine instead of a mentor. True mastery in supervision happens when you can take off the mask and say, I'm not sure yet. Let's look at the ingredients together. This transparency models exactly what we want for our supervisees to do with their clients, to stay curious, stay humble, and stay in the process. Your signature move this week is a reflective throwback. The next time a supervisee asks you, what should I do? Resist the urge to answer. Instead, throw it back with a lens. If you were watching a video of yourself in that session, what would the observer version of you suggest? Let's talk about that again. The next time a supervisee asks you, what should I do? Resist the urge to answer and instead throw it back with a lens. If you were to watch a video of yourself in that session, what would the observer version of you suggest? You're shifting them from passive learner to active practitioner, and you're taking the pressure off yourself to be the only expert in the room. This identity work is exactly where we start in quarter one of the internal landscape of the Supervision Smorgasbord journal. We spend the first few weeks of this journal really looking at that supervisor identity as a separate entity from your therapist identity. We look at that expert mask and the imposter feelings and how to build a supervisory palette that is based on curiosity rather than certainty. You don't have to be perfect to be a phenomenal supervisor. You just have to be present. Grab your copy of the journal at supervisionsmorgasbord.com, and I'll see you at the table.
This has been Supervision Smorgasbord with Dr. Tara Sanderson. Please like and subscribe on your favorite podcast app. You can find us at drtarasanderson.com/podcast and on all social media at Dr. Tara Sanderson. Thank you, and we will see you next time.